All right, so room 416, Miss Libby.
So Miss Libby is our 84-year-old female, history of adenocarcinoma with a biliary tree, recently hospitalized here for cholangitis, status post-ERCP with 2 stent replacements, here for gram-negative rod bacteremia. Events from overnight, she actually developed a rash all over her body, involving her forearms, chest, lower extremities. It's very pruritic and uncomfortable for her. Otherwise, she's been afebrile, vital signs unremarkable. Physical exam this morning was notable for some tenderness, palpation, epigastrum, and the hives, as I mentioned, all over her forearms, chest, and lower extremities.
Labs?
Labs this morning were notable for a potassium of 2.8. Her crit has been stable at 31.5. All of her LFTs are trending down. So her ALT is 52, AST is 60, alk-phos is 262, T-bili and D-bili are all in normal range. She had blood cultures which are now growing lactose-fermenting gram-negative rods, and her urine culture came back lactose-fermenting gram-negative rods. She had the MRCP, which the read is still pending.
And meds?
So medication she's currently getting the Zosyn, 3.375 grams Q6 hours, the Cipro 400 Q12 hours, some Senna and Colace for a bowel regimen.
Jean, any nursing concerns?
Well, our IV came out in the middle of the night. She's got a little bit of confusion, not significant. Her daughter stays with her, very involved, and her daughter actually just stepped out for breakfast. So those are the things we're working on.
All right, sounds good. Let's go see her.
Good morning, Ms.
Good morning.
Libby. Good morning. I'm Dr. Kelly. I brought my entire team with me here. We do these bedside rounds. We spend about 5 minutes with you just to kind of update everyone on the events, update you, and then of course if anything changes we come back later. I'm going to let everyone introduce themselves, okay?
I'm Dr. Pollia. I'm one of the hospitalists, and what's that? That means I'm one of the doctors at Rounds here on 4 West. I'm just going to leave my card with you because I'm in charge of the medical team taking care of you.
I'm Jill, your social worker.
I'm Jean, the nurse taking care of you today.
And I'm Kyle Stoller, one of the supervising residents. Nice to meet you.
So I told everyone about how you developed this rash last night that's been very itchy and bothersome. And we'll talk about that, but I want to see if anyone else has any questions for you and what questions you have for us.
How are you feeling this morning?
I'm feeling better.
In what way?
My pain has gone down,
Good.
but I'm still itchy from the rash.
And specifically, how does the belly feel?
It's better. There's some pain in the middle.
Okay. Kyle, any questions?
No, no questions now. Do you have questions for us?
Do you know when I may be able to leave?
Dr.
Yeah. So, we're hoping that you'll be able to go home on Friday. There's a couple things we need to sort out. One of them being what bug is in your blood, and so we know what antibiotic to give you. We're hoping that we can just give you an antibiotic you can take by mouth, but we need to figure that out. We should have that information by tomorrow, actually. The other thing we need to figure out is why this happened, whether it's your liver or maybe from a urinary tract infection. So we'll talk with the gastroenterologist today to see, based on that MRI you had last night, if they have any ideas where this might have come from. By the time we figure all that out, I'm thinking Friday is a reasonable day.
Okay.
Does that work for you?
Yes.
Would it be okay if we examined you as a team?
Sure.
First, we're just going to have a look at this rash.
Oh yeah, it's really all over the arms. Do you have it on your chest and back? Yeah. Let's see. Oh yeah. And you even have some on your back here too.
Any trouble breathing or swelling of your tongue?
No.
Would it be okay if you sit forward? We can listen to your lungs.
Sure.
Okay. Nice deep breaths out through your mouth. Good. Relax back. You can breathe normally. We're going to listen to your heart.
Okay.
Good. And we're just going to have a feel of your stomach here, okay? Is it okay if we flatten the bed out?
Sure. And I'm just going to have you bend your knees. That helps relax the belly so you can feel it a little bit better.
Any pain here?
No.
Pain here? How about right here?
Yes.
Is that similar to the pain that you had before?
Yes.
Does it seem like it's any worse when I'm pushing than yesterday?
No.
Okay.
How about pain down here in the lower part, right where the bladder is? No. Okay. Any trouble with your urine? Any burning or frequency going to the bathroom all day?
Yes, most likely.
Okay.
I'm going to sit you back up. Do you have any more questions for us?
So, as far as plan goes for today, kind of like I mentioned before, we'll figure out a better antibiotic for you because we're worried that the one antibiotic we were giving you called Zosyn might be causing this rash. So we're going to talk outside and figure out a better antibiotic, and we'll come back and let you know. We'll also follow up those results of that MRI you had yesterday and talk with the gastroenterologist about a plan, okay?
And I'll let your daughter know what's going on because I know she's very interested, so we'll keep her abreast, okay?
Thank you.
So I think maybe for the goal for you today is going to be to get that rash under better control and get you more comfortable with that. Does that make sense to you? And we'll put it up here on the board so that everybody will be on the same page with that. I'm also going to write down that we think you may be able to go home Friday. And that way, if your daughter's wondering, she can just check the board. A little question mark because we're not 100% sure.
Great.
It's nice to see you today.
Thank you.
It's great to meet you.
Bye-bye.
Bye for now.
So this is our 84-year-old female with history of adenocarcinoma of the biliary tree, complicated by cholangitis in the past, here with gram-negative rod bacteremia of unclear source. With regard to her gram-negative rod bacteremia, it's now growing lactose-fermenting gram-negative rods. I want to stop the Zosyn and change her to imipenem given that the fact that she has this rash.
What do you think the bug is? It's a lactose fermenter?
Yeah.
Okay.
I'm most worried about E. coli.
Okay.
It's a pretty common inhabitant of the biliary tree.
And do you feel like you need to cover, for example, Pseudomonas?
I think it's reasonable because Pseudomonas can inhabit the biliary tree.
So if you believe the lab, Pseudomonas is a non-lactose fermenter. You wouldn't necessarily need to. I think we'll have data later on today to help us, and so I'll let you make that decision.
Okay.
But we know we have a good microbiology lab, and if they're saying it's a lactose fermenter, you probably don't need to.
What's your money on for source if you had to put?
Actually, I'm leaning towards urinary tract, given the significant bacteria, and also the fact that her LFTs have been trending down since she's been here. They were never as high as when she came in with cholangitis. And her HIDA scan when she came in, it actually showed that her stent was working. So I know it's kind of we went for cholangitis because that was what she's had in the past, but I'm actually leaning towards urinary source now.
And I think that's quite reasonable. We'll still treat her as if she has cholangitis, but probably UTI is where the money will be.
Yeah.
Good, next issue.
So the next issue is this rash, as we talked about. I think it's probably just a penicillin allergy, and stopping the Zosyn will take care of it. As far as comfort goes, I talked with the daughter, and she really didn't feel comfortable with anything like Benadryl or something like that because she's become confused in the past with that. What thoughts did you have about what we could do to make her more comfortable?
Probably something topical.
Okay.
Something that we can start here. Certainly have the PCAs pay attention to skincare for her, and then educate the daughter and send her home with something like that until it's gone.
Okay. How about something like Sarna?
Yeah, that's a reasonable choice.
And her only other issue is the fact that she had a history of DVT. Her INR was elevated when she came in. Question of medication noncompliance versus recently being on antibiotics and having a drug-drug interaction. We've been holding it now, checking daily INRs. It's still 4, so we'll continue to hold it. Do you have any concerns about medication compliance at home?
No, I mean, the daughter is there, and actually she's going to take some time off. She's asking her job for a medical leave. So she'll be with her to make sure.
It may be reasonable to look back and see what her INRs have been doing. Do you think we might need to change her daily dose of warfarin?
I'm thinking we will, especially if we're going to send her out on an oral antibiotic like ciprofloxacin.
Okay. And we'll just make sure we transition very closely, communicating with the primary care doctor, and make sure you call the anticoagulation clinic to let them know.
Yeah.
And Dispo, what are you thinking?
Like I said in there, I'm thinking Friday. By the time I get this sorted out with GI, we have the data back from the micro lab, make sure it's sensitive to a normal antibiotic, and I think Friday is a reasonable goal.
So with her daughter being so involved, do you think we can make her a 2x10 for Friday? Do some work with the daughter, educate her, get things lined up?
Yeah, we'll try and have things set up for Thursday. You think you can?
Yeah,
get
I
that
think I
set
can
up?
get all the paperwork done by Friday morning.
Yeah, it should be a pretty simple discharge.
Great.
All right, let's move on
Thank
to the
you.
next patient.